major milestone for a partnership that helps cancer patients all across Metro Detroit. People gathered at Ford Field this evening, marking $5 million raised in 5 years for Game On Cancer. The partnership raises money to make sure cancer patients can make it to their appointments and continue to afford their homes despite the expense of treatment. Tonight's event brought together donors, survivors, and current patients at the Henry Ford Cancer Institute.
We wrap our arms around the entire patient and their family for everything from getting their bills paid when they're going through cancer treatment to, supporting new research to get new treatment. So this money really supports all of that, and I think it resonates with the community. They really want to make a difference.
Game On Cancer also targets research for new therapies. 100% of the money raised goes to support its mission.
Now to good health. Some cancers are very difficult to treat because of the way they spread, leaving little hope for affected patients.
But thanks to an advancement available at Henry Ford and select other hospitals, patients with these challenging cancers have a new option. Our Dr. Frank McGeorge is here to explain. Hey, Doc.
Hey, Karen and Jason. Yeah, so imagine a cancer that has sent microscopic seeds throughout the inner surface of the abdomen. It would be impossible to remove every single deadly cell, but using a newer combined surgery and chemotherapy technique, the impossible becomes possible.
75-year-old Eugene Chelsea of Clinton Township was healthy until late 2016.
I was having problems with my stomach.
He saw a specialist and eventually had a CAT scan.
Well, they found something on my appendix, and that was in November. So I went in and they found the cancer.
The first surgeon immediately recognized this was no ordinary cancer. It was cancer of the appendix that was also producing a dangerous mucus. Eugene was referred to Dr. Rupin Shah, a surgical oncologist at Henry Ford Hospital in Detroit, where a special procedure known as HIPEC is available. HIPEC stands for hyperthermic intraperitoneal chemotherapy. During the HIPEC procedure, the surgeon removes all visible cancer. Then, catheters are inserted to infuse heated, concentrated chemotherapy into the abdominal cavity, bathing all the organs with the cancer-killing drug. Meanwhile, another set of catheters are used to remove and then recirculate it. HIPEC can be an effective option for certain cancers that spread to the lining of your abdomen, including appendix cancers, colorectal cancers, gastric cancers, certain gynecologic cancers, including ovarian, and mesothelioma. In Eugene's case, Dr. Shah is optimistic.
If you catch it early on and you can clear all of that mucin and perform the HIPEC, that has shown there's actually durable survival, even patients who are 8-10 years out.
Some really fascinating video that shows this. There's a new option when it comes to treating pancreatic cancer. Explain that to us.
Well, first, it's important to delineate kind of three types or three general stages of pancreatic cancer. We talk about operable, we talk about inoperable but hasn't spread, and then we talk about pancreas cancer that spread, like Mr. Patterson's. This option that you're showing here with the MRI-guided radiation study that we're leading here from Detroit involves this, basically the ability of the MRI to watch where the pancreas is and watch where the other organs are so that we can deliver a very high radiation dose to the pancreas without causing ulcers in the stomach or duodenum.
Ford Health Systems rolling out a new art exhibit, and it is really pretty special. It's replacing old artwork in hospital rooms with patient-inspired art. Paula Tutman introduces us to just some of the artisans in a story that will definitely touch your heart.
So this is an art class where really art is the very least of it. Beating chemo, surviving cancer, finding beauty in the midst of the most terrifying moments of your life. That's actually what's going on here.
How are you feeling, Gina?
As if a cancer diagnosis isn't bleak enough, the reality of chemo can generally paint a pretty dismal picture.
All of a sudden one day I had an irritation in my throat and found out I had lung cancer.
It's been a traumatic experience.
At Henry Ford Health System's Cancer Institute, art therapy is being employed as part of the treatment plan.
It's been a pleasure, meeting the girls in the support group and talking about your symptoms and, just connecting.
Research has shown that creativity has powerful healing properties.
When you are participating in something creative, you're going to be battling chemo brain by building new neural pathways.
In these sessions, patients are invited to express themselves. No previous experience necessary.
Yeah, try that out. We're trying new things and you're being brave.
And their masterpieces will be distributed throughout the hospital system, in patient rooms and hallways, as a powerful testimony of hope and healing.
Today is quite a milestone for 3 Metro Detroiters.
They've survived brain cancer for 10 years. The chances of surviving that aggressive form of cancer for that long, less than 1%.
As Coco McAvoy shows us, it was an emotional day at Henry Ford Hospital.
Smiles, everyone. It's an afternoon of celebration at the Henry Ford Hospital for 3 people who survived an aggressive form of brain cancer for 10 years. But
and was told that
it's also a reminder of the difficult journey along the way. Chris G.
I'd be lucky
relives the moment he was diagnosed with brain cancer.
to make it 2 more years. And that was a generous from everything that I've been told.
But he did survive, and so did his new friends, Danielle Gillespie and Sasha Archer.
Today means I'm supposed to be here, and today means that everybody else that's here was a part of why I'm here.
They've developed relationships with each other and hospital staff over the years.
How many people I've seen from here go over the course of 10 years that you meet and lose, and it's overwhelming.
Are you all ready?
As a symbol, a butterfly release outside of the hospital represents their freedom after beating the odds.
Where I work, Henry Ford Allegiance Health Hematology Oncology, we focus on a really multidisciplinary approach, meaning that it's not just the surgeon, it's not just the oncologist. We look at the entire patient. And we also have a special certification, making us a breast center of excellence. This is a new accreditation. It's incredibly hard to get, and we have it.